talk about embryo transfer. Embryo transfer means where once the embryo is created in the lab, it is going to be put back into the mother's uterus. This can be done on the day 2 of day 2 of fertilization, the 48 hours embryo, a 72-hour embryo, or at a blastocyst stage, which is on the day 5 of the culture. So the transfer has to be, most important is smooth, and it should be absolutely painless and comfortable, because once there is pain, the prostaglandins are released, that impairs the implantation rate. What are the processes in implantation? We can talk in some other video, but now today to talk about the steps of embryo transfer. Embryo transfer is done without any anesthesia. You will be put in the lithotomy position, and the embryologist, the gynecologist will first clean you up, and there are different kind of catheters, meaning plastic tubes, which will be used to transfer the embryos. There are hard and stiff embryo transfer catheters, and there are some embryo transfer catheters which are soft catheters. Soft catheters are recommended because these cause very less trauma and it is easier to do it. We use Cook embryo transfer catheter, which comes as a outer and a inner. The inner is with the embryologist, for him to load the embryos. This is first inserted through the cervix, and it is held at a certain position that is just right and not goes too much into it to cause the endometrial trauma. The embryologist will then have this softer inner catheter. He load embryo into it in a very less media, like 15 to 20 microliters. So once this is in place, we ask the embryologist to load the embryos. Once it is loaded, we will then thread it through this, and then while we are doing this, we are all the time monitoring through the ultrasound whether it is where it is, and are we damaging any endometrium. And once we have an approximation, then we graduate up to the place where it is to be transferred, and then we inject it there. Once inside, then we hold for a 45-second time, and then we withdraw out the inner first, and once the embryologist checks and says there is no retained embryos here, then we give out the outer catheter, which are again checked, and once we are told that it is not retained, and the procedure is done, and the patient rests for about 25 minutes before any other activity is done. There are times when the cervix is stenosed and we are not able to approximate it, for which we actually first do a day 2 mock embryo transfer to see whether there is any stenosis, what is the passage, and in an event there is a stenosis, we dilate it at that stage so that we don't traumatize the endometrium which are formed. Sometimes during the process we have a lot of problem negotiating the canal, that we use a stillet. So this is a stiffened pie kind of a thing which goes through the outer and helps us negotiate the canal for us to then withdraw it and put the inner catheter with the embryo there. So this is how the embryo transfer is done, and more details in next video.